one?
Yes.
I told you that in dendrites, an EPSP which is made at the tip of the dendrite here is subject to a decrease in size. We call this decremental conduction. So at first it's about plus 50 millivolt, but when it reaches the soma it's about plus 10 or plus 5 millivolts. So it's a huge decrease in the size, right? And I told you that we need to change the membrane potential to threshold here in the initial segment in order to have the action potential, right?
Yes.
So, but this EPSP is not enough for this. So we need to combine several EPSPs together in order to have a very large change of potential, which is enough for action potential, right? And I told you that we call this summation. So, summation happens by combination of several EPSPs, and this can happen in time or in a space. Okay? So, but before that, let's see the concept. So imagine that this one is a neuron, like in the anterior horn of the spinal cord. So it's a motor neuron that innervate the muscle. You can see that there are hundreds of synapses on this neuron. So each of these green lines represents an axon terminal, right? So you can see that hundreds of synapses are here. So in this figure, you can see that 4 EPSPs from these synapses is not enough for action potential. If you combine 8 of these, again,
Also, it's not enough.
But if you combine, for example, 16 EPSPs together, then it can go beyond the threshold, and after that, you will have action potential. So it's actually a theoretical or an imaginary state. Okay? I mean, the concept is combination and summation of EPSP. So summation may happen from several on EPSPs from several synapses. For example, here a simplified figure shows that we have 2 synapses. So an axon terminal here, another axon terminal here. First action potential from the first synapse is made. So imagine that this one is the first EPSP, okay? And then the second EPSP comes, okay? So the second one comes. So in this example, there is no combination because the first one is separated from the second one, and they cannot combine together because before coming the second one, the first one is
Already done.
actually, vanished, that there is nothing from that, okay? So, but if they happen very fast, I mean, if they are very close together, these synapses, then EPSP from one is made, and before it go off, we have the second one, so we have combination of 2 EPSPs. So for this type of summation, we need synapses that are close together, right? When they are close together, then EPSPs from these synapses combine together, we have summation, and this summation makes it a higher voltage of the EPSP. Okay? So we call this a spatial summation. Why? Because we are talking about the states, synapses that are close together, right? On the dendrites. But another type of summation is temporal summation, which means EPSPs can combine together in time. So in this figure, we have only one synapse, but 2 repetitive action potential come one after the other. Okay? So action potential 1 arrives, takes EPSP number 1, so EPSP number 1. After a while, the second one comes, second one, and then we have the second EPSP, but again, they cannot combine if there is actually delay between these 2 action potentials. But if they come actually repeatedly and without any delay, any significant delay, then EPSP number 1 can combine with EPSP number 2, and then they can generate higher voltage EPSP. So now you can imagine that there may be, I don't know, 200 action potential, right? And 200 EPSP, so they can combine together, and they make a very large change of potential that exceeds the threshold, and after that we can have action potential, right? So temporal summation of EPSPs from one synapse, or spatial summation of EPSPs from several synapses, right? Provide the basis for generation of action potential in the initial segment of the axon. But neurons are different from each other. I mean, we are talking about one neuron, one imaginary neuron that has a threshold, right? Has a fixed membrane potential, I mean, resting membrane potential, but in reality it's not like this. We have billions of neurons in the brain, and each of them has its own properties. Some of them have, for example, lower resting membrane potential. Others have higher resting membrane potential. The threshold is not the same again, okay? So they have various thresholds. And then when they have action potential, the firing frequency is different. So let's compare 3 imaginary neurons here. So neuron number 1, 2, 3. Okay. So if we stimulate the neuron, I mean by making a potential or by injecting a current, okay, we can see that neuron number 1 is activated first, sooner, I mean. But neuron number 2 needs more change of potential. So the threshold is different. And neuron number 3 needs still more potential. Okay? So they are not activated all at the same time. So some of them are activated sooner, others are activated later. Right? And then let's compare them with the maximal firing rate. You can see that neuron number 1 generates about, the highest speed. Okay? We generate, for example, 400 action potential per second. But neuron number 2 generates only 200 action potential per second. And neuron number 3 generates 600 action potential per second. Okay? So neurons are different. And actually it depends on the number of EPSPs that they receive. Okay? And also their intrinsic properties of their membrane. So some of neurons may express more channels, and the kinetic of the channels may be different. Okay? Or they may receive, for example, more inhibitory synapses than excitatory synapses. Right? So if we consider this one again, okay, some of these synapses, for example, maybe inhibitory, others are maybe excitatory, right? So the combination of these activities determine the level of activity. So, where is it? Okay. When the sum of the excitatory drive is more than the sum of the inhibitory drive, then we can expect that the neuron will be in its excitatory state. Okay? Or if the sum of the inhibitory drive is more than the excitatory drive, then the neuron will be in its inhibitory state. Okay? So the neuron may receive 200 synapses. From these 200 synapses, 100 is excitatory, 100 is inhibitory. But it doesn't mean that all of them are activated at the same time. So plus 10, minus 10, minus 100, okay, so they nullify each other. For example, in one condition, maybe 50 of these excitatory and 20 of these inhibitory synapses are active. then the sum favors the excitatory. Right? In another state, maybe inhibitory drive is more than the excitatory drive. It depends. For example, you can consider that this neuron is located in the ventral horn of the spinal cord. Signals from the brain are coming down to this neuron. Okay? Some signals are coming from the brain, this part of the brain, and they tend to excite the neuron. There are also other signals coming from the, for example, brainstem, and they are inhibitory, so they tend to inhibit the cell. Okay? So in some states, signals from the cortex are more or higher, so they can activate the cell. In another state, maybe you can imagine that signals from the brainstem are more powerful. Then they can inhibit the cell. Okay? So, excitatory drive, inhibitory drive, excitatory state, inhibitory state are properties of neurons. And we have also fatigue of the synapse. Right? So fatigue means the synapse is not capable of passing the signal to the next cell. Okay? So it happens when we have repetitive activation of the synapse. So maybe we have a synapse like this. Okay? Imagine that this neuron sends 10 action potential per second. So this neuron receives all of them, but this one is able to generate 5 action potential per second in response to this activation. Okay, so every 2 action potential here generates 1 action potential. So after repetitive activity of this synapse, for example, we will have 10 action potential come here, but this neuron only responds with 3 action potentials. So the input is the same, but the output is different. Okay? Why this happens? Because this synapse is tired actually. It's tired. Okay, so we call this fatigue. The mechanism for this, actually some possible mechanism for this fatigue include exhaustion of the stores of the neurotransmitter. Maybe we don't have enough neurotransmitter. So neurotransmitter were released and don't have enough of them. Okay? Progressive inactivation of the postsynaptic receptors. So receptors of the postsynaptic neuron are not responsive to the neurotransmitter. Okay? Or there may be a shift in the concentration of ions. Okay? So channels are open for a long time, so ions go into the cell, so the balance between the inside and outside concentration of the ions actually changed. So it's not ideal for having enough action potentials. Okay? So possible mechanisms for fatigue of the synapse include these. Okay. There are some other conditions that may change excitability of a neuron. I mean their response to the synaptic activity. Okay? For example, alkalosis increases excitability in alkalosis. The normal pH is 7.4. Okay? If there is an increase in the pH or decrease in hydrogen ion, then neuronal excitability increases. This may increase the probability for having seizure in a patient that has epileptic seizure. So imagine that you have a patient with epileptic history. Okay? So this patient is prone to have a seizure attack. Some conditions may promote the seizure attack. One of them is increase in pH. Okay? For example, a psychological state in this patient may cause hyperventilation, increased breathing, and you know that increased breathing decreases hydrogen ion in the body, so pH goes up. After this, the patient may show a seizure attack. Okay, because neurons are excitable more But acidosis depresses neuronal activity. So, for example, pH of 7, okay, usually causes a comatose state in, for example, patients with diabetes. Okay, so a patient with advanced diabetes, okay, usually have decreased pH. Okay, this decreased pH usually may cause a condition like faint. Okay, we call this coma actually. Okay, so this coma happens because of depression of the synaptic activity in brain. Okay? Cessation of oxygen, ischemia, also causes depressed neural activity. So only some seconds of ischemia is enough for losing consciousness. Because brain neurons are very, very dependent on oxygen, and only some seconds of ischemia or cessation of oxygen supply to the brain may cause actually loss of consciousness. Caffeine, theophylline, theobromine all increase neural activity. Strychnine increases excitability by inhibiting some glycinergic neurons. So in the spinal cord, we have some interneurons that release glycine. And glycine is an inhibitory neuron, is an inhibitory neurotransmitter, right? So strychnine inhibits the release of glycine. And there is always a balance between excitatory and inhibitory neurons in the spinal cord. So when you actually remove glycinergic neurons, I mean their action, when you stop them, then excitatory neurons become actually released from the inhibition, so they show higher excitability. So strychnine increases the excitability, but the mechanism is inhibition of inhibitory neurons. Right? Anorthetics increase the threshold. So this way, they decrease the probability of having action potential. Right? So these are some conditions that affect synaptic activity. Any questions so far? Yeah. So let's go to the next topic. So for this topic, you should read the file. Okay, slides and notes. Actually, you have seen it before, I think. So it's here. Removed it. I think you removed it. Okay, it's here. So please read the slides and the notes. And if you have time, then you can also read the book. Okay? It's optional. For your exam, this file is enough. If you understand everything in class. So you can see that there are some notes under each of these slides. Okay. So. So the second file is here. I put it here. And the slides. For the sessions that were cancelled before, if you want, we can have online sessions.
Okay.
Is that okay?
Okay.
So then your representative can arrange some time with me, and we can have online classes.
All right.
Okay?
Thank you, sir.
You're welcome. So receptors and neural circuits. So let's see different sensory systems. Some of them. Let's see here. We have vision, smell, taste, touch, thermal senses, pain, hearing, balance, proprioception. Okay. So, this figure simply shows that we don't have only 5 sensations, 5 standard sensations that we are familiar with.
More.
We have more than 5. Okay? For example, proprioception means understanding the position of our body. Okay? For each of these sensations, we have some receptors. Receptors here are different from receptors in the synapse. Inside the synapse, the receptor means a protein located in the postsynaptic membrane which binds to the neurotransmitter. Okay? But here in the sensory system, receptor means a cell or a neuron which can collect information. For example, for vision, in the retina of the eyes, we have 2 types of cells called rods and cones. They are sensitive to the light. For smell, in the olfactory epithelium, we have a special type of neuron called olfactory neuron, or olfactory receptor, which is sensitive to odorant chemicals. Right? For taste, in the taste buds, in the tongue, we have specific taste receptors that are sensitive to chemicals in the food. Right? For touch, we have several types of receptors in the skin that are sensitive to pressure, and so on. Receptors for pain, receptors, for temperature, for pain, for sound, so we call them hair receptors. And we have also hair receptors for balance. Both of them are in the internal ear, right? And for proprioception, we have some specific receptors in the muscles that are sensitive to the length of the muscle or the force of the muscle contraction. Okay? So when I mention receptor, I mean this. Okay? So, in this table, you can see different receptors. You can see that we have at least maybe about 50 receptors here, right? Maybe more. So, mechanoreceptors are sensitive to mechanical deformation or mechanical change. So, you can see the list. So, in this category, we have hair receptors in the internal ear. We have hair receptors or vestibular receptors in internal ear. We have baroreceptors in the wall of the aorta, right? That are sensitive to pressure of the blood. So it's a type of mechanical receptor, right? So all of these are mechanoreceptors. The second category is thermoreceptor. Some of them are sensitive to cold, others are sensitive to warm. So we have warm receptor,
Cold receptor.
cold receptor. Nociceptors are sensitive to tissue damage, so they are involved in pain sensation. The fourth category is electromagnetic receptors. Rods and cones that are sensitive to light, and light is an electromagnetic energy. Right?
Yes.
So we divide them or categorize them into electromagnetic receptors. And chemoreceptors. So in this category we have taste receptors, smell, receptors that are sensitive to the level of oxygen in the blood, osmolality receptors, CO2 receptors. So all of them are chemoreceptors. Right?
Blood
Blood glucose receptors. So, in this sense, we can see that there are several types of sensations that we are not aware of. For example, sensation of blood glucose. It doesn't reach consciousness. You are not aware of that. But it's there actually in the body. Okay? So, in this figure you can see see several type of mechanoreceptors that are important for somatosensory system. Okay? So I will talk about this in the next session. I mean, today in the afternoon session. Okay, there are some principles about the receptors. The first one is differential sensitivity, which says any type of receptor only responds to one type of energy. So a cone in the retina of the eyes is only sensitive to light. It doesn't respond to pressure, for example. You cannot press your eye and see something. Okay? So the only type of energy which activates this receptor is light. Right? So differential sensitivity. Modality of sensation means any type of sensation we have. Right? So we have modality of vision, modality of hearing, modality of
pain,
smell,
touching,
or olfaction. Okay. Sometimes we have some sub-modalities. For example, for taste, we have sub-modality of sound, sub-modality of salt, sub-modality of bitter, sweet, right? Labeled line principle. So if any receptor only responds to one type of energy, then this receptor is connected to the CNS with an axon. So this axon we call this fiber, right?
Yes.
This fiber only carries one type of sensation. Right? So
it's stable.
So if we have, so this is a skin. Imagine that this one is a receptor in the skin. So we have a fiber, right? Which is a fiber of a pseudo unipolar cell, right? So it's located in the DRG, peripheral branch, central branch from here, in the dorsal horn of the spinal cord. Do you agree with me?
Yes.
Good.
100%.
So dorsal horn of the spinal cord. So this fiber that comes from this receptor only carries information about pressure. So imagine that this one is a pacinian corpuscle, which is sensitive to pressure. So this fiber only carries one type of information. So this fiber doesn't carry pain sensation. For example, if you increase the pressure, so this one is a pacinian corpuscle sensitive to pressure. Okay? So it carries pressure impulse. But if you increase the pressure, which gets painful, then this fiber doesn't convey any signal about the pain, because pain activates other receptors with the soma in the DRG, and they go to this one. So any fiber only carries one
One
sensation. So we call this labeled line principle. Get it?
Yes.
So receptors collect information. These information are of different types. Some of them are electromagnetics, others are chemicals, others are pressure, mechanical, right? But all of these receptors should convert these type of energies into an electrical signal. So a cone or a rod in the eye converts light to electrical signal, action potential, right? A pacinian corpuscle in the skin converts pressure to electrical signal, and so on, right? So, you know that we have resting memory potential in a cell, we have action potential, we have also synaptic potential, right? Excitatory, inhibitory, IPSP, EPSP. What else? Receptor potential. So when we press a pacinian corpuscle, this pressure is converted into a potential. right? This potential in this receptor is called receptor potential. It's not action potential, it's different from action potential. It should change the pressure to the threshold in order to have action potential again, right? So, all kinds of stimuli change the membrane electrical potential of the receptor. We call this receptor potential. The mechanism is different for different receptors. For example, mechanical deformation may open some mechanosensitive channels. Signal goes into the cell becomes depolarized, which is called receptor potential. If it's enough to go beyond the threshold, we will have action potential. Okay? Or, let's see, for example, chemical receptors. So, chemical binds to the receptor, the binding site. Changes the dimension, the three-dimensional structure of the protein. The protein is open in the channel. Ions can go in, right? Again, depolarization, action. So the mechanism is different. Okay, you read this. But let's see one of them. Pachydian corpuscle. So it's like this. We have a fiber, which is the axon here. Okay? The axon is myelinated, but the tip is not myelinated. And the tip of this axon is covered by a capsule-like structure. Okay? Actually, there are several layers of the capsule, but only one of them is shown here. Inside the capsule, we have a fluid. So it's full of fluid, right? So it's like this. The nerve tip is covered by capsule like this. Okay? Inside the capsule, we have fluid. So, if we press the Pachydian corpuscle here, so it's a mechanical change, right? This mechanical change is conveyed to the tip by way of this fluid. So the distribution of the fluid inside the capsule changes. And this carries the pressure or conveys the pressure to the axon tip. This mechanical pressure causes opening of some sodium channels. So here we have some sodium channels. Opening of these channels allows movement of sodium inward. Okay, sodium goes into the cell. So we have depolarization here. This change of potential is called receptor potential. This receptor potential actually distributes toward the soma, okay? This way. When it reaches the first node of Ranvia, here we have voltage-sensitive channels. So, channels that are involved in action potential. Sodium channels, potassium channels. They are sensitive to voltage. The change of potential causes opening of these channels, right? So we have two types of sodium channels here. Mechanosensitive sodium channels at the tip, voltage-sensitive sodium channels in the nodes of Ranvia. The nodes of Ranvia, in the myology, right? So this change of potential activates these channels. They are opened. Then sodium goes into the cell. We have a very large depolarization, and after that, a very large repolarization. This is the action potential. So action potential is made at the first node of Ranvia. In a synapse, initial signal or action development. Remember? But in a receptor, in the first node of Ranvia. After that, the action potential jumps to the second node. And then to the third node. What do we call this? This jump?
Depolarization?
No, this jump of action potential from one node to the next node. Don't remember?
Could you repeat the question?
Yeah. What do we call
Streaming? Streaming?
streaming?
Yes.
No.
Yes.
Could you repeat the question?
Yeah, the question is that Action potential in the first node of Ranvier jumps to the second one, and then to the third one. And this way it goes toward the spinal cord. We call this
No, do this.
date recognition. Remember from the cell physiology? Okay, cell date recognition. Okay, so did you get the concept here? Okay. So the relation between the stimulus strength and the receptor potential size. I told you, if you press the pacinian corpuscle, some sodium channels are open, the receptor potential is made. If you press the pacinian corpuscle weakly, only a few channels are open, the receptor potential is small. If you press strongly, then more channels are open, the receptor potential will be high. So there is direct relationship between the stimulus intensity and the receptor potential, but it's not linear. It's like this. Okay, the sensitivity is higher for smaller intensities. Okay, so the more the intensity of the stimulation, the higher the size of the the receptor potential. Now, the relation between the receptor potential and the frequency of firing, frequency of action potential. So, at first we have resting membrane potential in the receptor. It's about -90 here, right? Then you press the pacinian corpuscle, you have receptor potential. If the receptor potential goes beyond the threshold, we can start some action potential. If it goes further, then the frequency of firing increases. Frequency. Okay? So I may ask you, what increases by increasing the receptor potential? Frequency of action potential, amplitude of action potential, duration of action potential, threshold of action potential. Frequency. Right? So the scientists that discovered this won a Nobel Prize. Okay. So amplitude doesn't increase. So if you press the pacinian corpuscle more, it doesn't cause the size of the action potential gets higher. No, the frequency increases. Okay? So if you stimulate weakly, for example, it generates 3 action potential per second. If you increase the power, then it generates like 10 action potential per second. So the number of action potential per second increases. Again, relationship between the stimulation and the response of a receptor. So in condition A, we don't have any stimulation. So the response in the receptor is resting membrane potential. Nothing changes. Then you stimulate the cell. How? You press the cell, you keep it, you remove it. So you start pressure, you hold it, then you release it. Okay? So the response is a change of potential called receptor potential. In some books, they use generator potential. So generator potential equals receptor potential, right? It didn't reach threshold, so we don't have action potential. Stimulation C is more powerful, but shorter, right? So receptor potential goes higher than threshold, we have 1 action potential. So stimulation with the same intensity, but more duration. Okay? So you press, you hold it for more time, then you remove it. So as long as you have the pressure, action potential continues. Stimulation E has the same duration but higher in intensity. Right? So you press the pituitary corpuscle more powerfully. So as long as you are pressing the pituitary corpuscle, you have action potential. But the frequency here is more than frequency here. You have more action potential. Action potentials are tighter. Right? So we can say that the response of a receptor depends on both the duration of activation, the duration of stimulation, and the intensity of the stimulation. But the response of the cells are not the same for all receptors. Again, stimulation here, and these are the response of the cell. So imagine that each of these vertical lines are an action potential. Right? So we have several action potentials. So you start the stimulation, you start the pressure, and you hold it. In one receptor, you can see that at first you have several action potential, so more frequency of firing. Then stimulation continues with the same power, but the firing frequency decreases. There is a decrease in the firing. We call this adaptation. So adaptation means a decrease in the firing frequency in response to the constant stimulation. Right? So another cell responds to the same stimulation like this. At first, there are several action potentials, but then we don't have any action potential. It stops. Right? So this cell only responds to the stimulation at the beginning. So there is no response to the constant stimulation. So again, we have adaptation. But adaptation here is complete. Here, adaptation is partial. Right? So the first category of cells are called slowly adapting receptors, but the second category are called rapidly adapting. So let's see here, we have two rapidly adapting, two slowly adapting receptors in this example. So let's consider the hair receptor, this one. All of these hair on your skin are receptors. If you move them, you can feel it, right? Because each of them are innervated by a fiber. Okay, so you move the hair, so imagine that this one is a hair on the skin. You move it and keep it in this place. Okay, what happens? When you start movement, at first you have more than 200 action potential from this cell. Then, in only 1 second, there is nothing. Action potential stops. So we have complete adaptation that happens very fast. So hair receptor is a rapidly adapting receptor. Now let's see pacinian corpuscle. You press the skin. At first, firing frequency of pacinian neuron is very high, 250 action potential per second, but in a fraction of a second, you can see that it stops firing. Okay? So adaptation happens faster, and it's also complete. But compare these two with these two, spindle. Spindle is located in a muscle. When you stretch the muscle, you increase the length of the muscle. Muscle spindle is activated, it starts firing. At first, it generates high frequency firing, but then there is a decline in the firing frequency. But it doesn't reach zero, okay? So it doesn't stop. It continues to fire action potential at a slower pace. Okay? So we have action potential as long as we are stretching the muscle. or joint capsule receptor. So you rotate your joint, you bend your elbow, okay? It causes action potential from the joint receptors. At first, the firing frequency is high, then it declines. But it continues to fire as long as you keep your elbow bent. Okay? So these two are slowly adapting, and these two are rapidly adapting. So what is the importance of these receptors? So you can say that functionally slowly adapting receptors are good and great for having continuous understanding of the stimulation. Okay, for example, you may have a pain, and the pain is an important signal for your brain that something is going in your body and it's not good, okay? So you should think about that. You should do something for that, okay? So, and the pain continues as long as you have the injury. Okay? So it's very important for us. So, other type of receptors that show slow adaptation include muscle spindles, Golgi tendon apparatus, vestibular receptor for balance, pain receptors, baroreceptors, chemoreceptors of the carotid aortic bodies, right? But rapidly adapting receptors are also called rate receptors, phasic receptors. They are stimulated only at the beginning of the stimulation, when we have real change in the stimulation, right? So they are more sensitive to change of the stimulation, not the constant stimulation. But the slowly adapting receptors are more sensitive to constant stimulation. And they are important for prediction of the future, the future of the sensation. Okay? So, two types of receptors include slow adapting, rapid adapting receptors. Mechanism for adaptation is different. For example, in Pacinian corpuscle, I told you that there is a fluid inside that carries the pressure from the capsule to the axon tip. Okay, one possible mechanism of adaptation is the redistribution of this fluid. When you press the Pacinian corpuscle, at first the distribution of fluid changes, but then the fluid tends to actually remain in this new position. Okay, so the redistribution of this fluid is maybe a possible mechanism of adaptation. Another possible mechanism is accommodation. For example, you may have inactivation of sodium channels in the nerve tube. So these channels, mechanisms of the channels, are opened at first, but after that, they don't respond to the pressure anymore. Okay? So, the second mechanism of adaptation is achieved. Okay, in other receptors, the mechanism is different. We'll see them later. Okay. So, we have seen the receptors. Okay, some principles about the receptors. Then these receptors carry the signal to the spinal cord through the fibers. You know that we have myelinated fibers and unmyelinated fibers. We call the myelinated fibers A fibers. And unmyelinated fibers C fibers. We have 4 different types of A fibers. What are they? And one. Very good. The differentiation is based on here. Rapidness? Yeah. So actually, histologically, you can say that the difference is based on the thickness. A alpha is the thickest, and A delta is the thinnest myelinated fibers, right? But the thickness also defines the speed of conduction velocity. So the thickest one is faster, the thinness is slower. Okay. So let's see this figure. Myelinated fibers, unmyelinated fibers. Myelinated are called A fibers. Unmyelinated are C fibers. So we have A alpha, A beta, A gamma, A delta. Okay, you can see the conduction velocity here. For example, A alpha may carry the signal with the speed of 120 meters per second. It's very fast actually. But, for example, A delta may carry the signal at the speed of 6 meters per second. Right? Or the C fiber may carry the signal at the speed 1 meter per second. So if you, for example, imagine if you have a C fiber in the toe, right? The soma is in the DRG here, right? So it's about 1 meter long. So if you stimulate the tip of the toe, after 1 second you can feel it. After 1 second, you receive the signal in the spinal cord. Then it may need another 1 second to reach the brain. So when you feel something, actually, it's related to an event 2 seconds before in the toe, right? So if we only depend on C fibers, right? But A alpha fiber is very fast, 120 meters per second. So we can say that we can feel the event at exactly the same time that it's happening in the toe. Okay, so it's very fast. Okay, so another type of classification is used only for sensory nerves. So it's based on this, we can have type 1, type 2, type 3, and type 4 fibers. So this one is only used for sensory fibers. The other classification, this one, A and C, is used both for sensory fibers and motor fibers. Right? Okay, so you can see here that type 1 fiber roughly equals A alpha fiber in the general classification. Type 2 fiber corresponds to A beta and A gamma fibers. But type 3 mainly corresponds to A delta fibers. And type 4 corresponds to C fibers. Right? So, and here you can see some of the sensations that are carried through these fibers. Like tickle, you know tickle? Is carried by C fibers only. Aching pain is carried by C fibers. Okay. Aching. Right? Creaking pain only by type 3 or type A delta. Right? Signals from muscle spindle are carried by 2 types of fibers. One A fiber or type 2 fiber. Okay? Muscle spindle, muscle spindle. Primary ending, secondary. Actually, I will talk about this later. Okay? So, some of the information are actually conveyed through 1A fiber, others are conveyed through type 2. So, we have different receptors that use different type of fibers for transmission of the signals to the spinal cord. All of these sensory fibers have their somas in DRG. Dorsal root? Yeah. Great. So let's have a rest. After 10 minutes, we will continue.